So what happened? Right? That's what happened. He landed, but he didn't just bounce off like that. You see him right there. He's got the ball. He's coming down and breaks his collarbone. First of all, we're going to start with the clavicle fracture. Was that dramatic?
I loved it. It's too bad they just had the Emmys. You could have gotten one.
I know. So first of all, clavicle fracture in Jayden Reed. This is the, whoa.
That's his clavicle.
Good sound effects. Do you know what this is? Have you guys heard of slime? There are slime stores and slime kitchens. And so this was one of those little toppers that you put in a little container of slime that my daughter has lying around on the kitchen counter. Anyway, shoulders. So what do we got? Clavicle. So this is your shoulder. So right now, what we'll do, Jayden Reed, he came down. Video. Good? Got it? Let's go. So collarbone injury. So basically, see that? This is in your shoulder. I rip out the skeleton. See? Right? I'm protecting you. I didn't rip out your skeleton. So anyway, arm bone. This is your humerus. This is the collarbone, clavicle. AC joint, so that's the joint right here. That's the little nubbin you feel there. The end here is your acromion, and then you get your shoulder. This is your deltoid. Your pec is here. You like that? You like that? Look at that strength. And then you have your shoulder blade. That's on the back, right here, the spine of the scapula. This is where the supraspinatus, the rotator cuff, one of the rotator cuff muscles. You have your infraspinatus, teres minor, and then what happens? We'll get into it. The rest of the muscles, including the pec, but right now we're talking collarbone. So what happened? Right? That's what happened. He landed, but he didn't just bounce off like that. You see him right there. He's got the ball. He's coming down and breaks his collarbone. You know, we need better bones, man. I should not be able to bend it like a chicken wing, okay? So, he broke his collarbone. Now, we don't know where. We don't have the images. I'm not the treating physician or surgeon. I am a surgeon, but I'm not the treating physician or surgeon. However, he fractured his collarbone. That's all we know. There's different types. There's distal clavicle, middle clavicle, proximal clavicle. Proximal means closer to the midline. Proximal, middle, distal. So further out, closer to the lateral aspect of the shoulder is the distal clavicle, then you got middle, then you get proximal third. Divided into thirds because the treatment varies based on that. And it also, right here. What's right here? I hear it, someone's saying it. The corticoclavicular ligaments. Now, these are critical because a fracture on one side versus the other and an injury to the corticoclavicular joint really makes a difference in terms of the type of fracture pattern you can have. If you have it in the mid part of the clavicle, you can get some of the traps and the scalenes pulling it up, separated from this, or if it happens here and it's disrupted, you get the whole thing coming off. So there's different types of injuries and it's dynamic. Obviously, it's connected kinematics. We've talked about that before, where this is all connected to muscle, skin, bone, nerve, vessel, lymphatic, spine, tissue, head, neck, the entire axial skeleton, and the chest wall. Why the chest wall? Because you have the serratus anterior going up. You have the latissimus going up. You have the pectoralis major and minor going up. So there's a lot of muscles and joints around the shoulder, so a shoulder injury isn't isolated to the shoulder joint or just the clavicle bone. So one example is I had a patient recently came in that asked, we were examining his knee injury. He said, well, doc, why can't you just examine my knee while I'm sitting up? And here's the important part about it. If I examine a joint, you need to examine it fully. So I'll have them stand up, see how they actively move, but I'll also have them sit and lie down so I can mobilize everything, because I also need to understand what's happening at the hip and at the knee and at the foot. Look at their leg lengths, look at their overall alignment. Those are all important. And it becomes critical in work-related injuries, especially because many people have their knee injury, for example, and they're like, oh, it's sore, it's sore, it's sore. And later it comes up that, oh, some of the pain was actually referred from their back. So it turned out their back injury and their knee injury occurred at the same time. So connected kinematics, remember, it's important to understand that. So, oh, it's repaired. So, what do we do for clavicle fractures? Well, there's non-surgical and surgical treatment options. Typically, the easiest way to describe it is that the worst of the clavicle fractures are the ones that are 100% displaced with at least 2 centimeters of overlap and displacement. Tenting the skin. Open, obviously, they're the worst. Like if you rupture the skin, you have to go in and clean it out and fix it and repair it, because often there's more damage. There's damage to the muscles on top, there's damage to the skin, but there's also risk to the vessels underneath, which more likely in penetrating wounds or traumatic car accidents or vehicular trauma, as it were, if we get proper. So, but we're not proper here. We are unscripted. So, when we look at the clavicle, depending on the nature of the injury, if it's minimally displaced, typically we can treat that non-surgically. Sometimes, if it's even displaced a little bit, but not significantly, the soft tissue envelope. The soft tissue envelope, that's everything around here. Now, what's important about fracture healing? Come on, I know you know this, I know you know it, the periosteal sleeve. In kids especially, the clavicle often doesn't fully ossify until 22 sometimes in young males. So when you talk about the collarbone, the soft tissue envelope is important because, no, not cricket. We're not talking about cricket. We're talking about nerve vessel blood supply. What's the most important thing in healing? Blood supply. If you don't have blood supply, you're not going to heal. So that's why smokers have the biggest challenge. The nicotine completely cuts out the oxygen supply. And you can have a bone that would otherwise heal go on to a non-union or at least delayed union. Now, we're not talking about that for these athletes. As far as I'm aware, I don't know anything about their smoking and their recreational habits, but let's assume they're healthy, they have no medical disorders or inflammatory disorders or chronic disease as far as we're aware, and they're not diabetic, they don't have any chronic health problems, cardiovascular, neurologic, or anything like that. So their soft tissue envelope was fully intact. Envelope, 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 tomato, tomato, back. So the soft tissue envelope, let's assume it was intact, and then you break it. I can't break it, it's plastic. Then you have to talk about healing. So, and it also depends. If it's distal and it's minimally displaced, you can treat it without surgery. If it's mid-third clavicle and it's minimally displaced, you can treat it without surgery. If it's proximal third, most of those are treated non-surgically unless there's a complete disruption and elevation that affects your esophagus and your neurovascular structures. Now, the proximal third dislocations, they can be bad if they go posterior, exactly. So if they go back, because then they can hit the vital structures in the back, inside your chest. So typically we don't do much, in terms of mild sprains or dislocations anteriorly. Sometimes there's surgery options for it, but typically significant posterior 100% dislocations from athletic or traumatic vehicular trauma type of disorders, you do have to sometimes repair them. So in this particular case, it's non-surgical. So we know that it is either minimally displaced, minimally angulated, not significant overlap, or, I mean, you can have comminution. So comminution is multiple fragments. So sometimes we call it, like especially for calcaneus fractures, bag of bones. So what happens is the soft tissue envelope is intact, but it got smashed, so it just shatters, but the soft tissue envelope is intact, so it can actually heal. Now, the collarbone could do that. The soft tissue envelope could be intact, but say you get a strike, a smash right there, and it shatters the bone, but it remains intact and not significantly displaced where it's sticking up under the skin, then you can also treat it non-surgically. Timing, typically clavicles heal. Unless there's significant displacement, you have a high risk of healing non-surgically with minimal displacement, but you can get up to a 20% non-union or 30% if they're completely displaced and overlapping. Now, the overlapping and the displacement could happen in multiple planes. It could happen in the coronal plane. It could happen in the axial plane, right? And you can also have it in the sagittal plane. So there's multiple ways that you could have this injury. And in this particular case, it sounds like that it is a minimally displaced, minimally angulated fracture, but I have not seen the x-rays just based on the fact that they're treating it non-surgically. However, what if the athlete decided he didn't want surgery? What if it is completely displaced and overlapping and he decided he didn't want surgery? Possible. But I find it, I don't want to say unlikely, but I do find it less probable, less likely than likely that he would not want it fixed, because that's his catching arm. He landed like this, right? So he wants his length, because why is it important to have less overlap? Because you want your length. So he wants his length, he wants the strut. The strut is important because when we were monkeys, we held on to trees, right? So you want that strut for stability. And when he's reaching for a ball and catching it, the clavicle plays an important role. But so do all the other structures. Could you live with a broken collarbone? Absolutely. Could you live with a non-union? Absolutely. Could you live with a malunion, meaning the bone heals slightly crooked? Yes. But will it allow this athlete at his level in pro football to do what he wants to do? Less likely. So there you have it on clavicles.